Hello, welcome to Dentistry 101. Today I'm here with Dr. Nan Hatch, who is from the University of Michigan School of Dentistry. She is the chair of orthodontics and pedodontic dentistry, and she has completed her training at the Harvard School of Dental Medicine and the University of Washington, where she did her orthodontics degree and a PhD. And then she came to Michigan. We were lucky to get her here to do a fellowship in regenerative medicine, and now she is a full faculty member that we're delighted to have you here today. So Dr. Hatch, I want to ask first off, what does an orthodontist do?
What does an orthodontist do? Well, orthodontists work on the oral cavity. We straighten teeth. One component of that is the teeth, and another component of that is the facial skeleton. So we look at people's faces and we look at their teeth and we decide if things aren't fitting together well. Is it because the teeth are out of place? Is it because parts of the face are not in the right place, or a combination of both? And then most commonly we use braces, brackets, and wires for 6 months up to 2 years of treatment to get everything nice and straight, functional in the back, beautiful smile. On more complex cases, we work with other dental specialists, such as yourself, a periodontist. And we also, in some more extreme cases, work with oral surgeons and orthomaxillary facial surgeons who may reposition one or more part of the face.
So tell me a little bit about what the general orthodontist would do on, what is the common treatments they would be doing on a day-to-day basis?
On a day-to-day basis, the vast majority of patients we see are kids, usually ranging from 6 to, say, 10, would get interventive treatments, a headgear, an expander, limited appliances that will make things easier later. And then the rest of our patients, we're doing what's known as comprehensive orthodontics. It's full braces, upper and lower. We treat both children and adults. And that's what we do. So the best part is when people come in and they won't smile and show their teeth, and by the end of the treatment, they will give you a nice, big, confident smile. That
sounds like an incredibly rewarding aspect of dentistry. I'm curious, what got you interested in orthodontics to begin with? How did you get there?
So that is interesting and perhaps a little bit different than many other orthodontists. I have no orthodontists in my family. I actually did not have orthodontic treatment as a child, so I was not aware of it as a dental specialty until dental school. And when I was introduced to it, I was just drawn to it because of the combination of, as much of dentistry is, of mind and handwork. Every patient is a puzzle. The pieces aren't fitting together well, and you have to figure out the best way to get the pieces to fit together well to make them functional as well as the most attractive version of themselves that they can be.
So how do you become an orthodontist?
So like the rest of dentistry, 4 years of college, then 4 years of dental school, and then you do an orthodontic residency training program. In this country, it'll be a 2 to 3 year program.
Okay. And what sort of additional classes do they take when they're being trained as an orthodontist?
There's multiple sides to this, right? So there's the treatment mechanics part, like how do I use the braces? How do I move the teeth? And the basic physics that go along with that. Then there's growth and development. So if I see a child, are they growing normally? Is their face, are their jaws growing normally? And can I predict future growth? And can I manipulate future growth with use of different appliances that we use? And then there's the biology behind all of it. How do teeth move through the bone? How does this all happen?
When you go to an orthodontist, they're often very innovative in their thinking and training. What's coming down the pike for orthodontics? What's new on the horizon that our listeners might see in the future?
I would say the number one thing, and I think this shift is consistent with what is happening with dentistry in general, is the incorporation of novel, more modern technologies that are relevant to the fact that we are more computer and digital based these days. For example, the old, I put a bunch of goo in a tray and put it in your mouth so that I can have a record of your teeth to diagnose you when you're not in the chair. We're pushing that to the wayside, and now we're using an intraoral scanner, which is a wand that you stick in the mouth, and it just takes a whole bunch of pictures, and then you're able to generate a three-dimensional image of the mouth that way. Also, we're moving into 3D printing, so that you can print somebody's skulls, you can print somebody's teeth, you can potentially, or likely in the next several years, going to be able to print some of our appliances. There's a lot of computer work now that's being incorporated into the world of orthodontics.
So you're also a researcher. Tell us about how your research informs your practice, and what's something that's cool that you can tell our audience about your own work.
Let's see. I have a passion for orthodontics. I love orthodontics. It's a great field. I also have a passion for research. The primary bulk of my research time is trying to understand processes that control development of the facial skeleton and the skull bones. So there's a subset of orthodontic patients that are born with craniofacial anomalies. So they are born with abnormal facial shapes, abnormal skull shapes, and there are medical issues that go along with this, as well as social issues, because the face is extremely important for social interactions. So I study that at a fundamental level and also work on a translational level to test new drug therapies to try and intervene in some of these situations where right now all they have is a surgical approach.
Are there specialties within orthodontics that focus on that?
There absolutely are. And we have what's called craniofacial orthodontics. So at our school, and there's about 7 of them now. They're called craniofacial fellowships. So after you've done your 2 to 3 year orthodontic training, you can opt to do another year that subspecializes in treatment of these craniofacial patients. And then typically you would go on to be on a craniofacial team where you work with all of the other providers for these these children in concert throughout their childhood.
Well, it sounds like that would be an incredibly important aspect of dentistry and very rewarding for many patients, especially if you can change somebody's outlook and their projection or into the future as to what their lives might be. The last question I wanted to ask you is, what gets you excited about dentistry?
I am excited about dentistry because of the combination of mind handwork. I've always enjoyed working with my hands, but I also enjoy puzzles and thinking and ideas and asking myself questions and seeing if I can answer them myself or ask somebody else or look in the literature. And dentistry is absolutely that combination, right? So the vast majority of patients, once you're a well-trained orthodontist, you know how to treat them, but there's always that patient that walks in, whether it's a craniofacial anomaly or some other issue going on, where you really have to be ready to jump back into that educational, continually learning process to address the patient's needs.
Well, tell us a little bit about some of the most rewarding parts of orthodontics.
Well, there's one aspect of orthodontics that I think some people don't get until they're actually in the field or know somebody who's in the field, and that's that you really have a place to be a role model for your patients, for the children, for the teenagers. You develop real relationships with these patients because you see them on a monthly basis for up to 2 years and maybe even longer during retainer wear. You develop relationships with their families as you treat multiple siblings within a family. And so there's really a personal connection that develops that's very rewarding, and you watch these children bloom into young adults. It's a great place to be.
Thank you, Dr. Hatch. That was very informative. It was very inspirational to hear about all the aspects of orthodontics and all the treatments and leadership that the profession provides for our patients. I want to thank you, and I'm sure our listeners will be very inspired. So thank you again.